Welcome to Everyday Nursing Knowledge Lectures, and today we will learn care of patients with T-tube. T-tube is T-shaped tube, so it's called T-tube, and it is placed in common bile duct to drain bile. Now let's see the biliary system. Biliary system, it consists of organs and ducts. It helps to produce and transport bile. So bile is greenish brown thick substance. It is produced in liver and stored in the gallbladder. The bile produced by the liver flows through right and left hepatic duct to common hepatic duct. This common hepatic duct joins with cystic duct that's from the gallbladder to form the common bile duct. So T-tube is placed in the common bile duct to drain bile. This common bile duct opens in the duodenum and bile gets drained into the duodenum, and it helps to digest and absorb fat. Now let's see the indication of T-tube. One is cholecystectomy, that is removal of gallbladder. This can be because of cholecystitis, that is inflammation of the gallbladder which can lead to infection, or cholelithiasis, that is presence of gallstones which can lead to cholecystitis and infection. Second indication is common bile duct exploration or choledochotomy, that is incision of the common bile duct, and this is done for the removal of gallstones when gallstones get lodged in the common bile duct. So placement of T-tube helps the duct to heal and decrease swelling. Now let's see care of patients with T-tube. Immediate post of 1 to 2 days, drain start with some blood and progress to greenish brown, and it should not be more than 500 ml per day. If drainage increases, inform physician, and this drainage should decrease as the patient recovers. You have to position the drainage bag below the insertion site or below the waist level. This is because T-tube drains by gravity. Keep the tubing untangled and kink free, and instruct patient not to lie on the same side because this could compress the tubing and prevent drainage. Make sure the tubing and the bag secured while ambulating to prevent dislodgement. Inspect the skin around the insertion site. This is because bile is very harsh on skin. The dressing should be clean, dry and intact. If you have to change the dressing, clean with sterile saline and place a new dressing. Monitor for bile leakage into abdomen, which can lead to peritonitis, and the signs and symptoms are bloating, abdominal pain, especially with palpation, nausea, vomiting, diarrhea and fever. And you need doctor's order to clamp or flush the T-tube. T-tube is clamped so bile can drain to duodenum to digest fat. So clamp 1 hour before and 1 hour after meal. And you have to assess whether the patient tolerates. If the patient develops abdominal pain, nausea, vomiting, unclamp and inform doctor. If there is an order to flush the T-tube, you can flush with 10 ml sterile saline. So today we learned about care of patients with T-tube, and thanks for watching my video.